Kako. Good morning, good afternoon, good evening to you around the world. I see so many of you guys from Brazil, so I just wanted to say boa tarde. And I will start by stating that I'm Catherine Perkel. I am a professor in public health at the University of Hawaii at Manoa. I'm also the moderator for this session. So my home is what we call in town. I am in downtown Honolulu. And my favorite physical activity, very similar to Mele, is anything that gets me in the water, whether it's swimming, snorkeling, scuba diving, or kayaking. So here, my role, I think, my role is my background and my work as a life course epidemiologist, amongst other things. And my research largely focuses on adolescence and specifically the health of girls and women. So as you know, this first panel starts with children. And I'm just going to give a little bit of background before we get to meet our speakers. So we know it's well demonstrated through research that preconception, fetal development, early childhood, and adolescence set the foundation for future health. Events during these periods, such as adverse childhood experiences, also commonly called ACEs, can influence health decades later. Health-related behaviors such as diet, tobacco and drug use, sexual behaviors, and of course, physical activity engagement are largely established before adulthood. These experiences and behaviors are tightly linked to familial friendship and community bonds, as well as connectedness to culture and heritage. They manifest strongly across socioeconomic lines, with those from more disadvantaged backgrounds more likely to have lower quality diets, more adverse experiences, and less healthy environmental conditions than those who are more advantaged. This association with disadvantage is seen in many of our communities here in Hawaii, across the United States and internationally. While much research and attention on this topic is what we call deficits-based, and it has a focus on what's going wrong. While we know that healthy behaviors such as physical activity are critical to developmental outcomes in youth, for example, physical activity promotes mental health. During childhood, physical activity is very important to bone development and muscle condition, and it's critical for obesity prevention. Research, though, as I kind of highlighted already, especially epidemiological research, it really looks at determinants of sedentary behavior and low physical activity, and I certainly do this type of research. However, even in the most adverse environments, there are health-promoting interventions and opportunities that can change entire life courses, not only through healthier behavior, but also through increased connectedness to social support networks and community resources, greater connectedness to culture and heritage, as well as to one's physical environment and nature. So the presentations to come will highlight opportunities and interventions to promote culturally and regionally relevant behaviors, moving away thus from what is going wrong to what is and can we do right.